position myself so God, pandemic weight gain's a real thing. You good to go? All right. Hi, my name is James Michael Bowers, and thanks for tuning in today. This is our Northeast Citizens Meeting. We hold our Northeast Citizens Meeting on the third Thursday of the month from 5:30 to 6:30. Typically, we hold these meetings in person, but due to the pandemic and COVID, we've decided to hold these meetings virtually for the past couple of months, and we'll continue to do so until it's safe for us to be in person again. These Northeast Citizens Meetings are a tradition that go all the way back to the very first Northeast Lincoln representative, Marguerite Allschwede. And it's a time-honored tradition to continue these Northeast meetings. So I really appreciate you tuning in so that way we can keep these meetings going on in a new way, and as we continue to figure out how to get information directly to folks in our city. Today, I brought in Pat Lopez, who will talk a little bit about the COVID-19 vaccine and ways that we can stay safe. There's a lot of misconceptions out there about the vaccine, a lot of myths, a lot of things that aren't true that are being told, and so figured might as well be best to bring one of the most knowledgeable people in our city and in our state to answer some questions. So thank you to everyone who sent in questions ahead of time, and I've added them to the list, and I'll be sure to follow up with people who wrote in directly to share this video with them and to also respond to their questions. We'll start off a little bit by talking about Pat Lopez's history and her background. We'll talk a little bit about the vaccines overall, talk about getting the vaccine, priority groups, and then also we'll address head-on some of the myths about the vaccine itself. If there's any question that is not answered that you would like to get information on, please still feel free to continue to email questions in, and I'll respond when we get the answers, okay? All right, thanks so much. I'll turn it over to our esteemed health director and also Woman of the Year for 2020 from her award. Pat, would you tell us a little bit about your background and what led you to becoming the health director in Lincoln and Lancaster County?
Well, thank you, James, and thank you, everybody, for tuning in. It's really a pleasure to be able to share some information with you. I have a long history of work in public health. I was at Lincoln Lancaster Health Department for a number of years, and I retired to begin doing some different work with our health departments across the state and working on accreditation and legislative activity. I've also had a history of working here in the Lincoln community in establishing many different programs when I was at the health department, and formed some really strong relationships that I maintain to this day, as well as across the state when I had the opportunity to meet many other people in the community and form additional relationships. I've done a lot of work in the area of communicable disease, infectious disease, working with environmental health, establishing programs that improve access to care for individuals, working with cultural centers and addressing problems for people who are severely impacted by not having access to care. So my history is very varied, but it's always been in the community and related to public health. And as a nurse, I've had an opportunity to share some of those experiences and work with some great leaders. In addition to this work, I've worked nationally with the State Association of Local Boards of Health and with our public health accreditation body serving as a site visitor for them. So those are just a few of the areas I've worked in. Have strong relationship with UNMC. I did some of my graduate training. I graduated from the college there. So my roots are here in Nebraska. My husband and I have been living in Lincoln for over 40 some years now, so this is home.
You know, I first met Director Lopez a couple of years ago when we started going through our accreditation process through the Board of Health, and we're incredibly lucky to have her leading our response to COVID-19 and having her lead our health department in our city and county, and we're very, very fortunate to not only have you here today, but to have you leading that charge in our city and county. Let's talk a little bit about COVID-19. Can you provide an update on the recent numbers and statistics for COVID in our community?
Right now, to date, we have 25,697 cases in Lincoln. We added an additional 161 cases yesterday. We'll be doing an announcement on cases today. We usually do an update about this time every day. You can see the most current numbers on our website here. Thank you. And also, I just want to point out a few things to you. We're really excited. We announced on Tuesday that our community has moved out of the red and back into the elevated orange, and we're really excited about that. Our case numbers are coming down. They seem to have plateaued. We hope to continue in that direction. Our hospitalization numbers are improving, and improving means we have less. Our positivity rate still remains high, which is a concern to us, but it's still probably the only statistics that's a little bit higher than we were in October when we, early November when we went into red. We've had 74 deaths just in December from COVID-19, and that was 45% of all of our deaths. So we continue to monitor that, and those are always a grave concern to us. That's the loss of a community member, someone's family member, a loved one, and we're doing everything we can to prevent that from happening. As of yesterday, we administered 15,500 doses of vaccine. We have 2 vaccine types that are available now, you may have heard. One is Pfizer, and that has that ultra cold storage, and then the other is Moderna. And we are receiving both of those vaccines in the community right now. Pfizer, both vaccines take 2 doses at this time, and they're different time frames. Pfizer, you get the second dose in 21 days, and Moderna is 28 days or about. So far in our community, we've vaccinated the primary care providers. We're working on vaccinating our home health and hospice workers, our dentists, other therapy groups that are providing services in the community. We follow a regular schedule that's developed by the governor that identifies the priority groups. And right now we're in phase 1A. There's a phase 1A and a 1B, and Lincoln is in phase 1A. Our number of doses that we receive are somewhat limited every week. And the doses, people frequently ask, why can't we get more vaccine? We get what's allocated by the federal government, and it's a little over 22,000 doses a week for the whole state. And then based on our population and proportionally, those vaccines are administered. Some of the health departments across the state only receive 200 doses a week. So we are at a different place now in trying to move through 1A. We still have about 6,000 doses to do before we get to 1B. And that's, then we'll be able to vaccinate those 65 and older and those with underlying health conditions. And along that line, we opened up a registration yesterday for people in the community. And I was just telling Councilman Bowers, we have over 47,000 people registered now since yesterday when we opened up the line to take calls and for people to be able to go on the web. 2 easy ways. You can go on the web, and they're showing the application right now. It's very simple, getting your name, address, who your physician is, a few other things, how we can contact you when the vaccine is available to get your appointment scheduled. And if you have any underlying health conditions, very simple. But we knew many people probably wouldn't have access to the web or may have additional questions, so we set up a phone line. And that number is 402-441-8006. And actually over 100 city and county employees manned the phone yesterday. And in the first 30 minutes that the website was up, we were receiving over 100 people a second trying to enter and get their data in. So we had a little hiccup for about 30 minutes, then things smoothed out, and since then everything's been running very well. And we're really, really excited by the number of people who have registered. It just shows in Lincoln we have a tremendous interest in getting the vaccine. And that's not always what we see across the state. That's why some of my colleague health departments are able to move into other phases of providing the vaccine in the community. So you may hear from friends and relatives across this state, well, I already got my vaccine, and wonder, why am I not getting mine here in Lincoln? We should be able to get it. And it's because we have so many people taking the vaccine in these priority groups, and because of our limited supply. This week, we received 2,600 doses. The week before that, we received 500. So we're maximizing that. I want you to know that there's no doses sitting on the shelf or in a refrigerator. We're getting every one of them into an arm as soon as possible. On that vein, our hospitals, both Bryan and St. E's CHI, and even Lincoln Surgical Hospital and Bluestem, our federally qualified health center, have been tremendous partners for us in working. We're all working together to get the vaccine out. And our goal is to show everyone we can get the vaccine out so that we can get more, so we can reach our community members that much sooner.
There's a lot of great information in that. I think one of the things that kind of sticks out is you said that we need to get about 6,000 more vaccines in that 1A before we move on to 1B.
Right.
Do we have any idea like what the timeline might be for that? That's one of the most common questions that come up is at what point will folks in 1B have the vaccine available to them? Is there a possibility to know like how many days, weeks, months that might take, or is it still kind of up in the air right now?
I think we have at least after this week probably 2 more weeks of being in 1A. You know, our goal would have been to be done next week, but I think we have about another week before after that. So 2 weeks from now, maybe the first week of February, the second week.
And so as long as people are signed up on that website or they call into that 402-441-8006 number, the health department will then reach out to folks and let them know that they might be in the next category to get a vaccine.
Right, and what will happen is that we'll actually be able to set up an appointment for individuals to come in, so they'll know when their appointment day and time is and how to contact us if that doesn't work for them. We have all our preparations are in place to be able to serve our community and do that well. But it doesn't matter. One question I get asked a lot is, well, I didn't really sign up yesterday. Is it going to matter if I sign up today? And when you sign up has nothing to do with when you will get called to get your vaccine. So if you haven't gotten in yet or have had an issue with that, just call on the number at 402-441-8006. But do not worry, it's not a first come, first served basis.
One of the questions that I got asked a lot was, do folks need to talk to their primary care provider in order to get the vaccine, or do they need to only go through the website, or will it be their doctor that administers the vaccine? Can you talk a little bit about if a primary care provider plays a role in that, or if it's, how would they get the vaccine once it becomes available to them?
Right now, our private physicians don't have the vaccine, and part of that's because the ultra cold requirement for Pfizer, and then the additional tracking that needs to be done with the Moderna, and because our doses are so limited. In working with our primary care providers and our hospital systems, that's why we decided to work as a community together to maximize getting the vaccine out. You don't need approval from your primary care physician. If you have any underlying health problems that concern you, ask your physician if they have any concern about you getting the vaccine. But most often what we hear is physicians are really encouraging people because of the efficacy of this vaccine is really, really high.
One fear that I had heard from a constituent is knowing that different parts of the state are in different phases, 1A or 1B. If there's another part of our state or another part of our country that is even further behind than we are we at risk of losing our doses to those other parts of the state or other parts of the country?
We haven't seen that happen. I'm not going to say never, but we haven't seen that happen. We'd like people to give us more doses so we could move faster, but we understand the allocation goes to that area. And you know, another thing that sometimes people have been asking me with the registry as new, what if other people from outside of Lancaster County are registering? How are we handling that? Well, everyone has to put their address in the registration, and so we know if people live in Lancaster County. And another thing that we're doing is asking people if they have a physician. So their physician will be able to go in and look up and see that they've been vaccinated in the safe, secure portal that's only for health providers and information. And any information we receive is stored safely and securely, and nobody has access to it.
I think you touched on this a little earlier. Who determines the phases? Who determines who's in phase 1A? Who determines who's in phase 1B?
You know, part of it is the Centers for Disease Control gave some guidelines, and then the governor looks at those guidelines and works with his team, and they make the decision about who's in which group.
We had also gotten a question about if a person goes in to go get vaccinated in order to keep themselves safe, and getting vaccinated also keeps our community safe by making sure that we can squash the spread as much as possible. Is their name ran through any sort of database, any kind of criminal database? Or
No.
Okay.
Thank you for asking that. We don't ask for that kind of information. We don't look at that. And I think that's one thing with the health department. People feel safe. We have people from every area of our community coming in, and that's not a problem.
So people should feel safe coming in to get
Yes.
vaccinated.
You know, the most important thing we can do is all of us that are not for any health reason can't, but everybody should be vaccinated that can be vaccinated. The COVID virus doesn't care what your ID is or where you live.
Absolutely. How long after getting the vaccine does it provide protection from COVID?
You know, in the first dose, it's a smaller, you have about a 50% efficacy in 10 days. After the second dose, you reach in about 10 to 14 days the 95% safety. So you have a 5% margin.
If a person has already caught COVID or has had COVID, should they still get vaccinated?
Yes, they should still get vaccinated because we're not sure how long you have those immune cells available. In some instances, they're advising, you know, the 3 months delay, but that's changed now. Unless you've had one of the, and here's another big word, monoclonal antibodies, but it's the treatment that's being used that's been highly successful in preventing people from having complications. In that case, there's an advisement to wait, and we screen for that and talk to people.
I think that's good to hear, because even outside of being a councilman, just being a person in the community, I hear a lot of people have this this perception that, oh, I've already had it once, so I'm protected from it, from here on out, or I've already had it once, so I don't have to wear a mask or socially distance. If a person gets vaccinated, should they still follow that same kind of protection measures in order to keep everyone safe?
Yes. We need to do that, all of us, because not everyone's vaccinated, and as we were talking, we have such small doses coming in. So we're going to need to follow those precautions for some time. And the faster we can get everybody vaccinated, the more we can change and stop the virus from mutating into other viruses.
There has been a lot of myths and conspiracy theories about COVID-19, and I would like to talk about some of those directly. There's been some concerns that this vaccine was rushed and that it didn't go through the due process and just isn't safe because it was developed so quickly. Was this vaccine rushed through? Did it skip a bunch of steps in order to become available?
You know, that's a great question, and I'm often asked that, or it comes up and I hear people. And one of the things that's really important for everyone to know is that our country provided financial resources for our researchers who'd already been working on this process. This was developed with the same methods and measures in place as other vaccines. In fact, it was probably one of the largest clinical trials we've ever had in the United States. So we all should feel very safe getting the vaccine.
One question that I got, it said, does this vaccine alter your DNA?
No.
Kind of similar to that, are there any kind of microchips or tracking devices or implants in this vaccine that can follow a person wherever they go?
Absolutely. There's nothing like that in here.
Is the technology that was used to develop this vaccine, is it brand new, or is this process and scientific way of getting this vaccine, has it been around a while?
Yes, this is a tried and true method, and it's one of coronavirus. There's many different types of coronavirus. So this isn't, you know, the study of it, the research and the development of the vaccine have been in place for a long time. And they've continued to improve with the new technology that's been developed and made tremendous advancements in science.
I saw a social media post that said, we were able to create a vaccine for COVID in a year, but we haven't been able to create a vaccine for the common cold or for HIV. Can you talk a little bit about how we were able to come up with a vaccine for COVID, but not for HIV or the common cold?
Well, I think, you know, some of the coronavirus can be the common cold, but it's how the virus has mutated and how it is. And it took a long time looking at HIV to figure out some treatments. And just think, when HIV came about, where we were in the time versus where we are now in 2021. So we've had major advancements in technology and science that's allowed us to create the vaccine sooner.
What do you think is the best way to fight some of the misconceptions and myths that are out there about this vaccine, or even about, you know, coronavirus in general? It seems like that there's a bunch of half-truths, or, you know, I've seen social media posts that are that are missing a full explanation, right? They might take like a sentence out of context, right? What do you think is the best way to fight this misinformation?
I think look at, you know, trust your physician to give you clear advice. And I know, you know, everything we have on the health department website, it's our responsibility to give clear and accurate information to the community that's there. You know, people like Dr. Fauci and others that are providing information, we need to listen to those individuals and not just be reading some of these areas that really aren't presenting the whole truth about what is available and why the vaccine is important, why these measures are important.
Why should people get vaccinated?
Well, to protect themselves and to protect the loved ones. And it's going to help us as a community to move forward economically and health-wise much sooner.
I think that some folks kind of have the impression that masks and social distancing and the directed health measures are going to be in place forever. But what I'm hearing you say is that the sooner that we get this under control, the sooner we can go back to kind of how things were, where we don't have to wear masks and we don't have to be social distancing. And so taking our vaccine is contributing to the effort to going back to how things were.
Right. It's what we need to do to get us back and be able to be with one another again.
Over the past couple of weeks, I reached out to some folks who had experienced loss due to COVID-19, and it's heartbreaking to hear these stories of people who are impacted directly. One of the quotes that really stuck out to me is, that they felt like when someone in their family became infected with COVID-19 or the coronavirus, that they felt like there was some shame or stigma attached to it, and felt like that even if they had done everything right, they still felt like that there was this kind of judgment towards catching it. And losing someone in the middle of the pandemic, it's easy for numbers. We lost 74 people in December, and it's easy for people to not see that as a person and see it as a number. But hearing the story, I mean, that it's just heartbreaking. I mean, these are real people that we're talking about. These are our neighbors and these are our residents. And one thing that was a common theme was once they had lost someone that was close to them, then other people who had lost someone that was close to them started reaching out to them, and then starting to realize how this virus has impacted their families. I just think that's important to share because there's a Twitter account that's like Faces of COVID or something along those lines, and there's a very human aspect to this that I think people in our community are starting to realize.
And that's why this is so important. It's always important to remember why we're doing what we're doing. And, I take that very, in my work as a public health person, that's the most important thing to me, is to prevent the loss of life and the spread of disease. And that's really what this is about. It's about a health issue, and it's about something that we need to address because it's touched so many of our community members. With the loss of life, we have many people who are suffering lingering effects. These are very real things. There are actually COVID clinics where people go now that are suffering the long-term effects. So that's why it's so critical that we do everything we can. And we know that what we've done in our community by wearing masks, watching our distance, and washing our hands, and being careful about being in groups has really made a tremendous difference. It's really affected the number of cases we've had and the number of deaths we've had. But getting the vaccine is going to really move us towards that light. It is the light at the end of the tunnel for us.
We had someone who came and said that this doesn't affect children and it doesn't affect adults, that it affects mostly senior citizens and seniors that have lived a life. And I take real issue with that because our seniors have already paid their debt to society. We shouldn't expect a group who've already done their service to the community to take on the burden of dealing with COVID-19, and that makes me really frustrated when people say that. Is that accurate what people are saying, that this is only affecting seniors, or is this affecting people all across the lifespan?
It's affecting people all across the lifespan, and it's just coincidental that you are saying that. I just looked about an hour and a half ago at where our cases were in age range, and we have cases in every age across that in our community. So it's not just seniors that are impacted. And as far as saying, young adults have had serious consequences from the disease. Sometimes people don't say that, but it's really true. We also know that this has really shown a spotlight on people who have difficulty accessing care. Other members of our community, that it's really been a huge issue for them and really made us realize all the things that we need to do.
I really admire and respect our essential workers and people who are on the front lines, people who are people with Lincoln Fire and Rescue and hospital staff who are on the front lines and putting themselves at risk to take care of people that are complete strangers to them, in an effort to make sure that people still have access to health care. And one of the things that I saw someone make this quote, I can't remember who it was, but it was, even though we're past the holidays, is even if we have to stay socially distant and not have our traditional holiday celebrations, those essential workers are very used to working during holidays and being away from their families during holidays. So we can do it for them. They've done it their entire careers, and so we owe it to them. So a genuine, heartfelt thank you to people in our community who followed that during this holiday season in order to keep this cases down as much as possible. Is there any last message that you would like to say to folks in our community about staying healthy, or about COVID, or about the vaccines? Anything that you feel like folks should hear?
You know, one thing I think that people would like to hear is that our numbers of flu cases are down this year. And we saw this in other countries that experienced their winter months at a different time from us. So we're thinking wearing the mask and washing our hands has had an added benefit, which is great in keeping those numbers down. But I think the important thing is just to continue to follow these measures you have in place. Stay connected with those closest to you in the smallest group, those members of your household, and continue, trying to eat right. And do all of those things, exercise, move, those things that maintain us and help us stay at our best form.
Very cool. Well, thank you so much, Dr. Lopez, for joining us today. My name again is James Michael Bowers. I am the Northeast Lincoln City Council representative. This has been our Northeast Town Hall meeting. It's held on the third Thursday of the month at 5:30. We'll hold our next meeting in February. Next month we'll have Councilwoman Sandra Washington, who will be joining us. If there are questions that you did not get answered today, or if there's more information that you would like, please feel free to email me at jbowers@lincoln.ne.gov. That again is jbowers@lincoln.ne.gov, and I'll be sure to respond back with some with some facts and numbers for you, and provide whatever information I can. Thank you again for joining us, and we hope to see you next Thursday at 5:30, or in February, the third Thursday of the month at 5:30. Thanks so much.